Association for Credit Unions in Minnesota. And we offer this service to credit unions like the Mayo Employees Federal Credit Union. Disclosures, I'm licensed and contracted, and so are our agents, with all the plans that are available in Minnesota. And we are licensed in several other states across the country. And we're here to help you with answering your questions. And if you're a Mayo employee who has been on the Mayo plan and maybe you're getting ready to retire or retired, if you started working for the Mayo prior to January 1 of 2002, you're most likely going to be eligible for some benefits through a company called VIA Benefits, and your HR department will let you know that. So if you are, if you're going to get that health reimbursement money, ultimately you're going to need to go through VIA Benefits. If you go through us, you won't get your reimbursement money. So if you're eligible for VIA Benefits, we're happy to answer questions for you, but you will need to sign up for a plan through them to get your health reimbursement money if you qualify for that. So with that, we will start. Anytime you have questions, if you're online and have questions, just enter it into the chat and we'll try to get those answered for you. If you're in person, just raise your hand and try to answer questions as we go along. So the Medicare basics. Why would you want to work with TrueLink Medicare Advisors? What is Medicare? What does it cover? What doesn't it cover? We'll go over the different enrollment periods and deadlines. We'll talk about the costs associated with Medicare. What if you decide to work past the age of 65? Do you have to sign up for Medicare at age 65? We'll discuss that. And then take a look at private insurance options. So, information overload. If you watch TV at all, especially in the fall, September, October, November, it's constant Medicare advertisements. You have Joe Namath, William Shatner, J.J. Walker telling you to call this 800 number and you're going to get all this free stuff. A lot of that isn't available in Minnesota. These are national TV ads, and a lot of what they're making sound so wonderful, you're not going to be eligible for that in Minnesota. My suggestion would be, don't call those phone numbers. If you, as soon as you do, they're going to gather your information, they sell it to a third party, and then they're going to be calling you and calling you and calling you. But it's your life, you can do as you please. And then your mailbox, when you turn 64, will start filling up with Medicare advertisements pretty much every day. So that's why one of the reasons the Mayo Employees Credit Union has vetted TrueLink Medicare Advisors, they want to be able to offer this service to members with someone who's creditable and is going to do what's best for their members. So TrueLink Medicare Advisors, our services, there's never a cost for our services. We are here to help you. You'll never get a bill from us. If you end up signing up through a plan through us, we get paid a commission by the insurance carriers. Again, if you're someone who's eligible for the benefits through VIA Benefits because you started employment with the Mayo Clinic prior to January 1 of 2002, we can still advise you, but you will need to sign up for a plan through them to get your health reimbursement money if that's available to you. We'll help provide the education of the whys, and like I said, we offer multiple companies and plan types. Medicare is not a one-size-fits-all. Just because you have a friend or a relative who went with a certain plan or company, that may or may not be what's best for you. If you choose to meet with us, we're going to ask you for a list of your prescription medications. We're going to look those up on the Medicare website, and that's going to tell us what your costs are going to be, which plan is going to be the most cost-effective for you, so forth and so on. And then we're available throughout the year for questions and assistance if you need that. And then every year, open enrollment. We're going to go over the different enrollment periods, but the open enrollment or the annual enrollment period every year is October 15th through December 7th. And prior to that, and which is what we're doing right now, we're reaching out to our current clients, asking them to update their list of prescriptions. We're going to review all that when the new plan information comes out on October 1, and then we get in touch with our clients to say, yeah, your coverage is still your best option for next year, or oh, your coverage is changing a lot, you may want to look at some other options, and then we set up an appointment to meet with them. We do that every year. So original Medicare Part A and B. Medicare Part A covers hospitalization, skilled nursing if you need that, home health care, and hospice care. There is not a monthly premium for your Medicare Part A if you had the Medicare tax taken out of your paycheck or your spouse's paycheck for at least 10 years while you were working. Medicare Part B provides coverage for doctors and specialist visits, outpatient surgeries, therapies, medical equipment and supplies, ambulance, all those sorts of things. There is a monthly premium for Medicare Part B. This year, for most individuals, that's $185 a month. If you're in the, once you retire, if you're in the lower income category, we're going to go over that in a minute, but you may pay less than that. If you're in the high income category, you may have a surcharge added onto that. But there is that monthly premium for Medicare Part B, and that premium can change from year to year. It typically gets announced in October or November. I see you're writing, so I was waiting. I'm not going over the deductibles and copays because if you sign up for most supplement plans or Medicare Advantage plans, you're not going to have to deal with the ones that are listed there. So with Original Medicare, there's a lot of things Original Medicare Part A and B do not cover. They don't give you comprehensive dental coverage, worldwide coverage, hearing exams or hearing coverage, fitness benefits. They don't give you routine vision exams or eyewear, and they don't cover prescription drugs. That's why we'll go over the plans that do offer these benefits. So different Medicare enrollment periods. The first Medicare enrollment period is going to be based around your 65th birth date, and it's called the Initial Coverage Enrollment Period. It starts 3 months before the month you turn 65, the month of, and 3 months following. So there's a 7-month window around the month you turn 65 when you are first eligible to sign up for Medicare, unless you've been on disability earlier in your life, Social Security disability. This is when this period starts. If you're going to continue working, and let's say you're working for the Mayo, they have what's called creditable coverage. They have more than 20 employees, obviously. You can delay enrolling in Medicare. If you and a spouse are both on the employer plan, you can delay enrolling in Medicare until around the time of your retirement. If you choose to do that, we go to the next election period. That's called the special election period. And you would want to start this process 2 to 3 months before the month you're going to retire. And during that time, you would want to get signed up for Medicare Part A if you didn't do that at age 65. And you don't need Medicare Part B if you're still on an employer plan. So if you delayed that, you would want to start signing up for Medicare Part B 2 to 3 months before you're getting ready to retire. You do have 8 months after you leave your employer coverage, but you don't want to go without health insurance. So we can help you with all of that. But again, that's one of the special election periods are available if you continue working past the age of 65. I have a lot of people who say to me, well, I heard that I will pay a penalty if I don't sign up at age 65. That would be true if you're not working, but in a few slides here, we're going to take a look at, there's a form your employer will fill out for you. If you don't sign up for Medicare Part B because you are still working and your spouse is on that plan with you, neither one of you need to sign up for Part B at that time. This form gets submitted when you do finally apply for Medicare Part B, and that's what prevents any penalties. That form it's a simple one-page form, like I said, we'll look at it in a minute, but it's just attesting to the fact that you've had employer coverage, so you don't have to pay a penalty. Then, like I said a little bit ago, there's the annual election period. That's every year from October 15th through December 7th. This is for people who are already on some sort of Medicare supplemental or Medicare Advantage plans. It's a time that you can review your options. Let's say you got your annual notice of changes from your insurance carrier. That comes the end of September, and there's a lot of changes happening to your plan and you don't like those changes. You're allowed October 15th through December 7th, review the other options. All the new plan information comes out every year on October 1. That's when we can start looking at plans for next year, and it tells you these plans, this is what this plan is offering for next year. That includes standalone prescription drug plans. So it's very important that every year you at least review your prescription drug options, because those plans can change considerably from one year to the next. One year they may cover an expensive medication that you're taking, and the next year they may not. So you want to know that each year, and again, that's something that we help with But it's very important to have your prescription drugs reviewed every year. Yes?
Got a question in the chat. Is there something similar to TrueLink Medicare advisors for the state of Florida?
Yeah, there's a lot of agents. We are licensed in the state of Florida, so we can help. If you want a virtual appointment, if you don't want a virtual appointment, if you want to meet face-to-face with an agent in Florida, we have what's called an upline. In the insurance business, that's very common, but they're based in Florida, so we know a lot of agents in Florida, good agents that would be able to help you if you don't want to do something virtually with TrueLink. And we'd be happy to make that recommendation. And then there's one more enrollment period for people who are on Medicare Advantage plans. It's called Medicare Advantage Open Enrollment Period, and that's every year from January 1 through March 31st. And let's say, because this does happen every year, you think, I like my plan, I don't think I'm going to bother my agent reviewing my prescription medications. I'm sure nothing really changed. January comes along, you go to the pharmacy, and you find out that maybe you're on a tier 3 expensive medication and your plan's not going to cover that anymore, and you don't want to pay $600 to $700 a month for it. Well, you still have one more option. If you're on an Advantage plan, from January 1 through March 31st, you can review other options that are available to you, and you have one option to make that change. It goes into effect the first day of the following month that your application gets submitted. So that's what the Medicare Advantage Open Enrollment Period. There are those few who utilize that. Typically, we do a good job of reviewing coverage with all of our clients during the annual enrollment period, so that's not going to become an issue, but that's available to those people who may need it. Any questions on that? Okay. So delaying Medicare benefits. Working past the age of 65, we can help compare your costs with your employer plan to costs if you were to leave your employer plan at age 65 going on to Medicare. I can tell you right now, most of the Mayo plans, the plans that Mayo offer, you're better off staying on those than going on to Medicare at age 65. The Mayo plans are deemed creditable by Medicare, and you can apply for just Medicare Part A at age 65 if you want to. The reason, because you don't pay a monthly premium for Medicare Part A. The reason you wouldn't want to apply for Medicare Part A at age 65 is if your employer plan has an HSA or a health savings account where you get the debit card to help pay co-pays and that. Once you've signed up for Medicare Part A, you can no longer contribute to your HSA account. So if you're the employee, if you're the owner of that account and you have an HSA plan through your employer, you do not want to sign up for Part A at age 65. Otherwise, there's really not much reason not to sign up for it at age 65. And it's a fairly easy process. You can apply for Part A and or Part B online. The web address is ssa.gov. It's just the Social Security Administration's website. And when you type in ssa.gov, right on the main page, there's a section that says apply. You can apply for Medicare. You can apply for your Social Security benefits the same way. But if that's something you need help with, we can certainly help you with that too. When you are ready to retire, that's what you would want to do. If you do have an HSA account through your employer, you're going to want to stop contributing to that. If you're beyond the age of 65 when you retire, you want to stop contributing to your HSA account 6 months before the month you're going to retire. So what I recommend to folks is, that's not something that's easy to remember, but if, say this fall, you knew you're 67 years old, you know you're going to retire next year, the wise thing would be, once your new plan goes into effect in January, is just stop contributing to your HSA in January of the year you think you're going to retire. It's not a huge deal. If you forget that, you will get taxed something on the contributions you made if you didn't stop 6 months prior, but you're not talking huge amounts, but that would happen to you if you didn't stop contributing to your HSA account if you're beyond the age of 65. And there's a form, like I said, your employer will complete for you. So it's called the Request for Employment Information. Section A, the employee completes. Section B, the employer completes. And with this, they're just attesting to the fact that you had employer coverage and therefore you will not have to pay a penalty if you didn't sign up for Medicare Part B at age 65. You do not have to complete this form if you're signing up for Medicare Part A and B at age 65. This is for those people who worked beyond the age of 65 and didn't sign up for Medicare Part B at age 65. So you can do this online. It's a little faster with the Social Security Administration. If you, there's two forms you fill out. You fill out this one if you're applying for Medicare Part B, and there's a Medicare Part B application. If you print those off and fax them to Social Security, they do process it a little bit faster than if you just submit it all online. But again, that's something that we can help you with. If you need these forms, if you're close to that age, I can certainly email those forms to you too. But they are available on the Medicare website, but we're happy to send those to you once you need those. Any questions on that? Okay. So I mentioned income impact. So this is a chart for Minnesota. It's not going to vary a lot from state to state, but there is something called extra help that is available to lower your costs for your Medicare Part B premium and your Medicare Part D, which is prescription drug coverage. And the column on the left is based on your family size. When you go across the top, the percentages are the percentage of the federal poverty guidelines. If your income is below these levels based on family size and percentage of federal poverty guidelines, once you retire, if your income drops below this, you might be eligible for extra help in getting help paying for your Part B premium and your Part D premium. You can contact your local county Department of Human Services to get help with this, or you can contact Social Security. They will, when your Medicare card comes, they will automatically send you this form of applying for extra help. If your income is going to be above these thresholds, you most likely won't qualify for it, but they will send that application to you when you receive your first Medicare card also. The other side of that coin is if you're in the high income category. There's something called the income related monthly adjustment amount, and based on your income from 2 years ago, Social Security works with the IRS. These are your federal tax returns. And if your modified adjusted gross income is at a certain level, you're going to get charged a surcharge on your Part B premium and your Part D premium every month for the rest of the year. So this year, the income threshold, if you file your taxes as a single person, if your modified adjusted gross income from 2 years ago was over $106,000 a year, they will add on, Social Security will add on a surcharge to your Part B premium and your Part D premium. If you're married filing jointly and your income from 2 years ago, your modified adjusted gross income was over $212,000 a year, you'll have, surcharges added on to your Part B and your Part D. And you can see in the middle column here, it shows that if your modified adjusted gross income from 2 years ago was, let's say, $250,000, they're going to add $74 onto the $185 a month. And they're going to add on $13.70 for your Part D, your prescription drug portion of your premium. And as you go down, if your income falls into one of these categories, the amount of increase for Part B, that's in addition to the $185 a month. And in the far column on the right, that's in addition to the $185 a month. And again, Social Security is going to let you know if you are going to be charged this surcharge or not. It's every month for the rest of the year, and then every year they reevaluate your income from 2 years ago, looking at your tax returns from the IRS. And if your income drops below these levels, then they will no longer charge you the surcharge. The income thresholds do tend to increase a little bit every year. So those aren't set in stone. They tend to go up a little bit every year. Okay? Private health insurance options. There are what's called supplement plans or Medigap plans. We'll go over those. There's what's called Part C, or Medicare Advantage plans. We'll cover those. And then there's Medicare Part D standalone prescription drug plans. So with Medigap or supplement plans, most of the country, they're going to be called Plan F, Plan G, Plan N, Plan L. We don't call them that in Minnesota. In Minnesota, nobody knows why, but we don't. In Minnesota, they're called Basic Plan, Extended Basic. Most of the carriers also have what's called a copay plan, and some of them have a high deductible plan. With a supplement or a Medigap plan, your benefits do not change from year to year. They stay consistent. Your premium typically will go up every year, but your benefits will not change from year to year. With a Medigap plan, it's for medical coverage. Medigap plans do not include coverage for prescription drugs, for dental or vision. So if you go with a Medigap plan and you want coverage for your prescriptions, which most people do, if you want dental and vision coverage, you have to buy insurance policies for coverage on those types of things. With Medigap plans, typically there's no network. There are some Medigap plans that do have, Blue Cross has a couple Medigap plans, Blue Cross of Minnesota, where you may still have a network, but for the most part, there's not a network, which means with a Medigap plan, any provider who accepts Medicare will accept your Medigap plan. It travels with you when you're leaving the state or the country, and it will go with you if you relocate to another state. That's not necessarily a great thing. Minnesota does tend to have some of the highest priced Medigap plans in the country. So if you were to move even across the border into Wisconsin, where their Medigap plans are about half the price of what they are in Minnesota, if you wanted to sign up for a Medigap plan in Minnesota or in Wisconsin, let's say if you moved, you would have to answer health questions because you're not losing your coverage in Minnesota. So that may or may not be a good thing depending on if you ever left the state of Minnesota and had a Medigap plan. If you, it says can ask health questions, that's changing a little bit in Minnesota. The Minnesota legislature has created an annual enrollment period for Medigap plans. This is just for the state of Minnesota. That's starting the fall of next year of 2026, meaning if you want to enroll in a Medigap plan because you didn't when you were first eligible, you're going to be able to do that in Minnesota starting the fall of next year, where you can do it without being asked health questions. Another type of plan is Medicare Part C, or in Minnesota we have Medicare Advantage plans and we have Medicare cost plans. The Medicare cost plans are only available in 21 counties. Goodhue County is probably one of the closest where they would be available, and we have Medicare Advantage plans. With Medicare Advantage plans, they do include everything all together for one monthly premium. So they offer your medical, your prescription drugs, your dental, vision, hearing, free gym membership. There's a lot of extras that Medicare Advantage plans offer, all for one premium. There are provider networks with the Advantage plans in Minnesota. We do have insurance carriers in Minnesota where 97% of providers are in network, including the Mayo Clinic. There's only certain Medicare Advantage plans the Mayo Clinic will accept. The plans where 97% of providers are in network, they're accepted by the Mayo Clinic. But I highlight that because that's very different from what it is in other states. We had someone online ask about Florida. Medicare Advantage plans are very popular in Florida. And what's popular there are the zero premium plans, but you really have to be careful in other states with Advantage plans, making sure your providers are in the network with whatever plan you go with. In Minnesota, like I said, there are a couple different insurance carriers where 97% of the providers are in network. It's not as big of an issue in Minnesota as it is in some other states. And with Advantage plans in Minnesota, there are two different types of plans. There are HMO plans and there are PPO plans. I advise against going with HMO plans if you do any traveling because your benefits are very limited if you go with an Advantage plan that is an HMO plan. If you go with a PPO plan, all the PPO plans, Advantage plans in Minnesota, offer a nationwide network of coverage. So if you go with an Advantage plan and it's PPO and you travel a lot, you're going to have coverage all across the country with the PPO Advantage plans in Minnesota. With Medicare cost plans, I don't think anybody, if you're in Olmsted County, they're not even applicable to you. Did you have a question or no? Okay. If you move outside of the county where your plan's available with an Advantage plan, or you move to another state, you would need to find a plan that's available to you in either that county or that state. The nice benefit about losing coverage against your will, so if you have an Advantage plan and you move where that plan's available, you've lost that coverage against your will. If that happens to you, you're automatically eligible to sign up for a Medigap plan if you want to, without any health questions being asked. So that's one of the pluses here of this. You'll never be asked health questions on a Medicare Advantage plan, and the benefits can change from year to year, and the premiums can change from year to year. With Medicare Advantage plans, you won't be asked if you're a smoker or a non-smoker. With Medigap supplement plans, you will be asked if you're a smoker or tobacco user. If you are with a Medigap plan, your rates go up if you're a tobacco user. Not the case with Advantage plans. And then the Medicare Part D prescription drug plans. These would be for those folks who either went with a Medigap or a Medicare cost plan. The standalone prescription drug plans, also known as Medicare Part D plans, they can be paired with your Medigap policy or with a Medicare cost plan. Every company has a formulary, and the formulary is simply the list of medications that they're going to cover, and they vary from one plan to another. But that tells you if they're going to cover all of your prescriptions, what your copays are going to be, what the deductible is going to be, if they have a deductible. And again, that's something that we go over with you if you utilize TrueLink Medicare Advisors. You want to know, make sure that whatever plan you sign up for, that your prescriptions are going to be covered, and you want to know what your costs are going to be when you go to the pharmacy to pick them up. Every plan offers mail order service, and then there's going to be different tiers of coverage. So typically Tier 1 and Tier 2 for your medications are going to be for generic medications. Tier 3 and 4 are going to be for brand name medications or for some of the more expensive generic medications. Tier 5 would be for specialty medications. Tier 6 is kind of going away next year, but that would be for any companies that offer Tier 6, that's for the lowest cost generic medications. There are penalties if you don't sign up for prescription drug coverage when you are first eligible or going on to Medicare. I've been doing this for 17 years, and I've had clients over the years who say, I'm not taking any medications and I never will, and some of them never do, but some of them come back 5 years later and say, oh, my doctor's put me on a medication, I need to sign up for a prescription drug coverage. Well, they have to pay a penalty for the number of years they didn't have coverage when they could have, and it's 1% of the national average. And that 1% is times the number of years you went without, and then that gets added on to your monthly premium every month for the rest of your life. That penalty never goes away. So there are some good options, at least in Minnesota and pretty much nationally. If you're someone who's not taking any medications, there are plans at a minimal cost that I would advise you to take that include prescription drug medications. So just in case you ran into this down the years. We can't predict what our health is going to be down the road, but at least it would help you avoid those penalties. Any questions on that? And then something that's new this year is Congress has capped the cost of everyone's medications at $2,000 a year. And if you're on expensive medications and the retail price reaches $2,000 before the end of the year, you're no longer going to pay anything for your medications. Once you hit a cap of $2,000, and for some people, it's a very complicated formulary on how they reach the $2,000, but most people, it's not a true $2,000 out of their pocket. But if you hit that level, you won't pay anything the rest of the year for your medications. The insurance companies are required, starting this year, to pay for your medications once you hit that cap. A lot of people don't come close to hitting that cap, but if you're someone who does, it's good to know that your costs are going to be limited. Again, when we meet with you and review your prescription medications you're taking, we're going to be able to tell you right up front, yep, it's saying you're going to hit that $2,000 cap in this year or this month of this year or whatever, so that you're better prepared for that. Also, what's new this year is Congress is requiring every insurance carrier to offer payment plans to smooth out the cost of your medications for the calendar year. So let's say you're on a couple of Tier 3 Jardiance or Eliquis or some of those medications this year where you could hit that cap in the first month or two and you're retired, and that could be hard for some people to come up with that kind of money, $2,000 in just a month or two. So every plan is required to offer you a payment plan if you want to spread your costs out over 12 months instead of getting hit in just a couple of months. There's no cost for the program. You would enroll directly with your insurance plan. And if you sign up for this because you're in that category, you don't pay anything for your medications when you pick them up at the pharmacy. Your insurance carrier will bill you each month for the cost of your prescriptions. Any questions on that? Okay. So premium costs with Medicare and private health insurance options. We know that for Medicare Part A, you don't pay a monthly premium in most cases. Medicare Part B, the monthly premium this year is $185. And then if you go with a Part C Medicare Advantage plan where all of your benefits are combined together, those in Minnesota and in most states across the country, those plans start at $0 a month, and then they can go up to $100 or more per month depending on the plan that you go with. If you go with a Medigap plan, those generally start, if you go with a high deductible plan, around $75 a month, or if you go with a plan where you pay a very small deductible and then you don't have any co-pays for your medical care, those in Minnesota run $300 a month or more. And then if you have a Medigap plan, as I said earlier, if you go with a plan where you pay a deductible of $257, but then you don't have any co-pays when you go to the doctor or hospital after that, you'd need to add on a prescription drug plan. Those can run anywhere from $0 to $100 or more, depending on which plan best covers your medications. And then if you want dental and vision coverage, you need to buy insurance plans for that. So the Medigap plan is typically going to cost you more money in Minnesota than an Advantage plan, but I have clients, like I said, I've been doing this for 17 years. I still have clients who go both routes. It's really what's best for you, and I'm not biased one way or the other. I want you to do what's best for you. So we'll go over both options with you. We listen to what you have to say, and then you can sign up for whichever option that you want. Any questions on that? Okay. So with that, you have folders that were handed out, and if you're online, you'll receive some attachments later today. But in your folders, there's a form that looks like this. If you fill that out, you'll want to leave it with me, but if you fill it out, please put an email address on there. And how I'm going to utilize this is I'm just going to send you a thank you email for attending our seminar, and just say, when do you need help with your Medicare, if you need help. And if you respond, then we'll coordinate whenever that time comes to meet with you face-to-face, if that's what you want to do, and review your options. If you're someone who works at the Mayo Clinic in Rochester and you're going to be utilizing VIA Benefits, I still meet with a lot of those people. VIA Benefits isn't as familiar. They're based in Texas, I believe, with Minnesota plans, but at least we can advise you on which plan we feel is going to work best for you. And then you can, if you're working through VIA Benefits, you can tell them which plans you want. But if you fill that out, like I said, we're not going to be pestering you and we're not going to be calling you all the time. If you put an email address on there, I prefer to contact you by email instead of phone because everybody's so mobile these days. I don't want to be calling you while you're in the line at Target or something. But you're not obligated to fill it out, but if you do, we'll send you a thank you email and follow up with you that way. Any questions on maybe what I talked about, or maybe I didn't talk about something that you were hoping to learn about today? I'd be happy to answer any questions either in person or online. Okay. Well, if you do, let me go to, this is our team here. And let me see. Yeah, we took our slide off. I didn't realize that. Do they have my email address when you send out for the online folks?
I believe so.
Okay. I think they do because, so if you're online, the email attachments will have my email, my contact information. If you're here and you have a folder, my business card is in that folder if you have questions about anything. But, and even if maybe you don't want to ask in front of other people, but I'll be here if you have questions you want answered. But otherwise, thank you for attending today, and hopefully we can